guys, Dr. Andy here. Today I want to show you Graston technique, which is a instrument-assisted soft tissue technique. Fancy way of saying that we use a metal tool to help solve soft tissue problems, okay? And in this case, we just shot a video that kind of explained how we get trigger points in our upper back, right? And shocker, I kind of gave away a secret in there that everyone thinks that I'm special because I'm so quick at finding the problem areas, but unfortunately I'm not that special. Really what it is that everyone has the exact same trigger point in the exact same spot of their body, and it's right here in the upper back. And where does it come from? It comes from hours spent sitting at a computer where we slunge forward, and it puts a tremendous amount of strain on the muscles of the neck and the upper back, and as a result we get a lot of tenderness and a huge trigger point right here in the muscle belly, okay? So what we're going to use is we are going to use our Graston tools, and we are going to get in there and try and break up some of that tissue, okay? That's actually a little bit of a misleading comment. We're not really kind of getting in there and breaking up any of soft tissue. What we're really doing is we are triggering the body to help heal itself, okay? So with Graston technique, along with many other soft tissue techniques, even like using my hands, dry needling, everything that we're trying to do is actually to bring blood flow to the area. And when you bring blood flow to the area, it's going to kill pain, but carried in that blood is a bunch of like growth hormones and collagen and other proteins that are going to help heal your body, okay? So first thing that we do is we use a larger tool to scan the area. And when I say scan the area, that's literally what I'm doing. What I'm feeling for is changes in the texture. Through the tool into my hand, I can actually feel where it feels like gritty underneath, where I'm moving along, and suddenly it feels like I'm going over, instead of it feeling nice and smooth, it starts to feel like I'm going through and hitting some sandpaper maybe underneath, okay? And when we hit that, that means we know this is an area that we need to work on, okay? So just to give you an example, we just identified that everyone pretty much has a trigger point right through here, right? And so when I did that scan, yeah, I could actually feel a little bit of that sandpaper underneath. So what I do is I take my more of a treatment applicator, the tool itself, I get in there and I start forming, I push down and in, it's really not uncomfortable, and I start doing a star pattern, trying to hit it from every single angle. It will start to turn bright red, and we may even get to the point where you start seeing little tiny red dots. That is called petechiae. That is actually the bursting of little blood vessels underneath the skin. That is fine, that is healthy, but it is our red light. Meaning green light is when skin looks like that. Yellow light is when it starts to get a little bit red like that. But if you start to see the little tiny bursted blood vessels, the petechiae, that's our red light. That means we have done enough treatment in this area and you need to move on to someplace else. Takes about 1 to 2 minutes per zone or per area that you start to dig in with this tool before you start to see that, okay? So that is Graston technique for a trigger point in your upper back. It is really, really helpful for the nagging type of pain that comes right through this area that's so common in so many of us, okay? So I hope you learned something. If you have any questions, send them our way, and always remember to live with passion, not pain.